All right, good afternoon, everyone, and welcome to our virtual world. This is the first time I've done anything like this, and hopefully it'll all work out for everybody and you can get the information that you need and still keep yourself safe. So good afternoon. I first want to start by talking about the situation at the national level. I think it's been clear that the federal response has been deficient with mixed messages and very slow actions. At the same time, states and cities across the country have been stepping up. Yesterday, the U.S. Conference of Mayors sent a letter to Congress, signed by 303 mayors, including myself, asking for $250 billion in emergency supplemental assistance. We are asking that this aid be provided directly to America's cities to help address the impact of COVID-19 pandemic. Cities like Philadelphia need this aid because we have the largest concentrations of people, because we have high levels of poverty, and because time is crucial. Funneling federal aid through state governments may make sense during normal times, but these are not normal times. It is not sufficient now. It adds bureaucracies and delays to getting the aid. Yesterday, as you know, we established a testing site in South Philadelphia. Dr. Farley will have an update on how that is going, but he has made clear to me that supplies are short, which limits our ability to test. The need for supplies is but one example of how federal aid sent directly to cities is very urgent. Direct federal aid will allow us to maintain city services and protect families and local businesses from the economic fallout of this crisis. This funding will support those most critically impacted by the crisis: financially vulnerable residents, small businesses on the margins, and community-based organizations, and will protect public health, human services, and the economy in this extraordinary time. And I will note that this letter sent to Congress is signed by both Democratic and Republican mayors. The impact of this virus is bipartisan. The federal response should be as well. So now I'd like to turn things over to Dr. Farley for his update. Thank you.
Thank you, Mayor, and thank you for joining. I'm going to give you the latest on the spread of the coronavirus here in Philadelphia, then an update on testing, and then a little bit about our healthcare systems. Since 1 p.m. yesterday, when we reported on this, there have been 18 new cases of coronavirus infection reported in the city of Philadelphia, bringing us to a total of 85. Now that 18 is less than we reported, 23 yesterday, but over the weekend, not all the laboratories send us data, and so that may be partly reducing those numbers. We expect that to increase more in the coming days, certainly on Monday. A little detail on the 85 people who've been reported so far. Of those, 5 are under the age of 20. 43 are between the ages of 20 and 39. 20 are between the ages of 40 and 59, and 17 are over the age of 60. Of the 85, 12 have been hospitalized. 12 of the 85 were hospitalized. And of the 85, 16 are known to be healthcare workers. I also have to report that we now have the first confirmed case of this infection in a nursing home resident. Provides an opportunity to talk about that problem. We have been trying very hard to avoid this. We know that nursing home residents are particularly vulnerable, but it is difficult to prevent this infection from spreading into every institution. We in the Department of Public Health work with nursing homes every year around the epidemics of influenza that happen every year that often get into nursing homes. It can be difficult for nursing homes. So we're familiar with this sort of situation. Our staff are going to this nursing home on site today to help them try to contain this infection within the nursing home. They have a number of steps that they can take to try to protect the other residents. But this is the first that we're hearing of this. I would expect that there may be more of these in the future as this epidemic unfolds. They're difficult to completely stop, but we want to protect as many as we can. One of the best ways we can do that is to reduce the likelihood that the virus is going to get into there by a visitor coming to the nursing home. So we're recommending today to be firmer about this than we have in the past. No visitors to nursing homes. No visitors to nursing homes. At the same time, no visitors to hospitals, because that is going to protect the residents. Many of these facilities have already taken this step, but to those that haven't, let this information you have today serve as a reminder of how important this is and to take that step right now. For people who want to stay in contact with their relatives in nursing homes, we still think you need to do that, but you can do that by telephone, you can do that by video chat. Here's an opportunity to set up that mechanism so you can keep in touch virtually. Now let me talk about the availability of testing. Most of the large health care providers in the city have testing sites available. We had 20 that were in operation yesterday. They did approximately 1,700 test samples yesterday. We expect more of those sites to open up next week. There are fewer of these test sites that are going to be available over the weekend, but it will grow over time. All of these sites have a shortage of the test kits that they use. That means that they have established some clinical criteria, some medical criteria for who deserves to get a test. So here's some general guidance for everyone, just to remind everyone what we said before. If you don't have symptoms, don't get a test. We don't want to waste those supplies for you if you don't have symptoms. If you have symptoms, but you're otherwise young and healthy, you don't need a test. You can stay at home. If you're not having severe health problems, you can ride this out at home. If you have symptoms of this illness, a fever, a dry cough, and you want a test, contact the provider where you last received care. It could be a regular doctor, it could be the hospital where you went to the emergency room in the past. All have set up mechanisms where you can speak to a provider in advance and find out whether a test is appropriate for you. And they're going to apply their criteria. It may not be appropriate for you, even if you think it is. So you have to speak to a provider in advance, and if they do feel it's appropriate, they'll write a prescription and send you to one of their sites. Now we know not everybody has a provider, and the system doesn't work for everyone, and we know it's been difficult for many. So that is where the site that we set up in South Philadelphia yesterday comes in. It's a site in the parking lot of Citizens Bank Park, where the Department of Public Health, working with our state and federal partners, have set up a drive-through testing site. Yesterday, this site tested 91 people. Those included 60 people from the city of Philadelphia and 31 from neighboring counties. Of that 91, 50 were healthcare workers. The site is open today from 2 to 6 p.m., and it'll be open tomorrow from 2 to 6 p.m. Because of the shortage of supplies and because of the interest, we have these criteria for who can be tested at this site. Our top priority is going to be healthcare workers who have symptoms. That's to protect all of us. Nobody wants to have a healthcare worker with this infection taking care of them. The second is going to be people over the age of 50 who have symptoms. Okay, so those are the two categories of people that we're offering tests to at this site. We will turn away people from the site if they don't meet those criteria. I'm sorry to say that, but we need to save these supplies to the people who need it the most. Yesterday, we turned away about 20 people from the site, so we'll continue to do that. My apologies for those people, but those who are healthy and just simply worried, the test is not for you. If you do come to the site, you don't need an appointment. There's no cost, but bring your driver's license and bring your health insurance card if you have one. That just helps us with information. If you don't have a health insurance card, no problem, we can test you, but the insurance does help us. If you do come, also expect that there will be a wait. Okay, there's a limited number of people who can do this, and there are many people who have an interest in this. Then moving on, as you've heard, there is a shortage in the city, in the state, and in the nation of personal protective equipment. That's the masks, the face shields, the gowns that healthcare workers use to protect themselves and protect patients when they're in the process of patient care. I understand that there are industries that use this sort of equipment that are beyond healthcare industries, and that some companies may have some of these materials that they have in storage. So I'm putting out a call here in Philadelphia today. If there's any company or any other group that has personal protective equipment that they have stored that they're not using, please contact us so that we can make that available to the healthcare workers who very much need it. If you have that sort of information, send an email to eoc.logistics@phila.gov, eoc.logistics@phila.gov. Then on the healthcare system, we do expect in the coming days to weeks an increases in demand for emergency care and for beds in hospitals. Just to remind people that most people with this illness will recover without care. They don't necessarily need to be seen by a physician, don't need to go to an emergency department. So if you're young and otherwise healthy, and you're not having difficulty breathing, just stay home. Stay away from other people for sure, but stay home and try to ride it out. If you have difficulty breathing, that's when you need to go to an emergency department. And we're going to try to save those facilities for those of you who do have that need. And then for everyone else who is otherwise feeling fine right now, just a reminder, there are mathematical models about how this is going to go, and the most effective thing we can do to try to protect our healthcare system is to do the social distancing that we're putting in place now. That slows the epidemic wave. If the epidemic wave slows, then at its peak, it's the lowest. That means that the healthcare system has facilities available for people who need it. So stay away from other people, wash your hands, stay home as much as possible. If you want more information, again, www.phila.gov/COVID, or if you have medical questions, 1-800-722-7112. Thanks very much. I'm going to turn it over to Brian Abernathy now.
Thank you, Dr. Farley. I want to start off by thanking you, the Department of Public Health, your staff, the Office of Emergency Management, for yesterday's launch of the testing site in South Philadelphia. I also want to thank the partners in this effort, the U.S. Department of Health and Human Services, the Pennsylvania Department of Health, and the Pennsylvania Emergency Management Agency, and of course the Phillies for letting us use the parking lot. While the numbers tested are not huge, it was a flawless and important launch. We hope to be able to expand the capacity of that site in the future. We're also continuing conversations with the governor's office over the question of restrictions on business activity. But even before that is complete, we have issued new guidance on construction throughout Philadelphia. We are providing additional time for construction that is in progress for them to make sites secure. All construction must stop by next Friday, March 27th at 5 p.m. The additional time beyond the state deadline is provided in the interest of public safety and for the protection against unnecessary property damage. Again, construction sites must be shut down and made secure by March 27th at 5. Contractors are directed to take proper measures to protect adjacent properties. They must remove and fasten items that are or could become loose, secure sites against trespass, and complete work necessary to protect and ensure the structural integrity of the buildings under construction. Unoccupied residential properties must be left in safe and habitable condition. Routine maintenance and repair of existing buildings is exempted from the order and may continue. Emergency systems repair and replacement are also exempted from closure and may continue. L&I has issued a blog post on these changes that includes further details, so please look for that at phila.gov/LI. Also yesterday, as you may know, we announced that Martin Luther King Drive is now closed to vehicular traffic from East Falls Bridge to Aikens Oval. This is in the interest of facilitating social distancing among trail users. This 24-hour closure will last until further notice. We strongly encourage residents to stay indoors as much as possible. However, we also recognize that physical activity is important to well-being, and under current restrictions are still providing opportunities for park and trail use. We encourage residents to please maintain social distancing in the course of outdoors recreation. The closure of MLK Drive will provide additional space for these activities to be conducted safely. We do advise that you should wash your hands for at least 20 seconds, 2 happy birthdays, or use hand sanitizer after every visit to an open outdoor facility. I also want to remind residents that our Indigo Bike Share program remains in operation and is available for those who need to get to life-sustaining services or those looking for a social distance for recreation or fitness. Indigo bikes are safe to ride, and I encourage residents to continue to utilize this service. As SEPTA service is reduced, Indigo remains a viable transportation option. Before we start the Q&A portion, I do want to thank the press corps for their patience as we work through this virtual press conference. It is appreciated and look forward to continued partnerships. We're now going to turn it over to our online moderator.
All right, good afternoon. We will now move to our Q&A portion. For all the reporters logged in, if you could please use the raise your hand feature and we will unmute you one by one to ask your question. Okay, first up is Sean Walsh with the Inquirer.
Hi, can you hear me?
Yes.
Great, thanks for having us virtually. A few questions from the newsroom. Well, first, Mayor Kenny, with the letter you signed, you had some critical remarks for the federal response. You had previously been declining to criticize, federal leadership on this, just to make sure everyone's getting along together. What changed for you, and why are you now more critical of DC?
Well, it hasn't changed. You asked me about President Trump yesterday, and I said I had no comment about him personally, but the response of the federal government has been deficient. I think it's clear it's been deficient, and that's why cities and states have had to step up in the manner that they've stepped up. So I don't have political complaint as far as, an individual person. We're talking about the system as a whole, and the system is deficient and is failing us, and we need help. And that letter is asking for help in a bipartisan way.
Thanks. And let me just pull up questions from everybody else. You might have answered this. How many people were tested at the South Philly site? You said that. Dr. Farley or Brian, do you guys know anything about these testing sites that appear to be being set up outside of local Rite Aids? Are they part of a city effort, or can you tell us about those?
So that we are aware of one site that outside of a local Rite Aid, similar to the South Philadelphia site, that is hopefully will be operational at some point in the next 1 or 2 days. But we are aware of the site. We'll have more details about that once those details become clear.
Gotcha. And this is from Joe DeStefano for the mayor on the impact on the construction industry. Let's see. About 30,000 union construction tradesmen in the Philadelphia area, were working before this crisis. Half could be out of work. We're hearing from the Building Trades Council. Can you talk about the impact on the construction industry, or what went into this decision?
We are following the guidance of the Commonwealth and the governor's order to hold all of this activity. There's a waiver process, I believe, that's in effect that will be considered by the state government or by the governor's office on whether or not to grant a waiver for specific either emergency construction or any building a hospital, for example, or things of that nature. We're following state guidance on this, and we think it's in the best interest of the health of everyone.
Gotcha. And the Building Trades Council is suggesting that this would be a good time to deep clean schools and catch up on deferred maintenance and asbestos treatment and things like that. Is that?
There's a discussion about that, but we don't know whether that's moving forward or not. But that is in discussion phase.
Gotcha. And this also from Joe, the city pension system obviously is heavily reliant on the markets and the stock exchanges, and so they were underfunded before. Have we gotten to the point where we're talking about strategies for dealing with the widening of the hole that is expected to be caused by this?
Well, we were on the right track before this pandemic. We will reassess once it ends to determine how much money we have spent and what the stock market's impact has been, and we'll readjust in this budget cycle and probably in budget cycles going forward. But I have no specific information. If you look at the stock market every day, it's a roller coaster ride of 1,700 points down, 900 points up, 800 points down. At the end of this whole process, we'll figure out where it lands, and then we'll adjust accordingly.
Gotcha. Is ending drop consideration as part of that? I'm guessing it's probably.
The drop conversation is not it's not appropriate for this pandemic. It's been discussed, it's been voted on, and it is what it is. I voted against it when I was in council, and I'm not accepting it as mayor, but I think that's kind of an outside issue relative to this.
Fair. And Dr. Farley, you already talked about this, but and you've been talking about it, the shortage of testing. Can you describe a little bit more in terms of how PPEs relate to that? Is part of this that, yes, there's a shortage of tests, but also do healthcare workers have to use PPEs that could be used for treatment for testing?
Correct. So when healthcare workers are doing the sample, they're putting themselves in exposure to the person who's coming in for a test, and these are people who have a high probability of actually having this infection. And so those healthcare workers need to have very good personal protective equipment when they do that. And the shortage of personal protective equipment is definitely getting to where it's limiting the kind of testing we can do. So that's why we are asking for additional PPE and trying to figure out how to extend the use of the PPE we have available to us.
So in South Korea, they used widespread testing to, target where it was spreading and contain it there. Now that we're switching to identifying people who are most at risk or in the healthcare industry, is it fair to say that we are, I don't want to say giving up, but taking the focus on identifying where it's spreading and now just containing or dealing with it as it spreads?
Yeah, so we have been following the South Korean model as much as we can, and it was my hope when we started that we might be able to contain this. At the moment, it seems to be spreading very quickly, more so in New York City area than in Philadelphia right now. Nonetheless, the news has not been good in the last week as far as the overall spread. When you combine that with the limits we have on test kits and personal protective equipments, we're not looking like we can contain this right now. And so we're going to be trying to protect the people who are most vulnerable. At some point, the number of cases is going to go down and we can go back into more of a containment approach.
I realize this is a problem everywhere with the test kits, but is Philadelphia worse off than some other U.S. cities as far as the availability of test kits?
I don't have the answer to that. There's no sort of inventory at the city level here or elsewhere, the total number of test kits available. I would strongly suggest this is a national problem because I know we've been trying to get supplies from the same manufacturers and they're running short because everyone else is trying to do the same thing.
Thanks. And lastly, Mayor, I went out last night to do some reporting to see how the social distancing measures were working. I saw a basketball game. I saw a lot of kids in a park hanging out and definitely not doing social distancing. And, I walked by a party or what looks like a party. Do you think it's working? I mean, at the same time, Center City was basically empty, but do you think it's working enough?
We're doing our best we're doing our best to get the message out. We've closed our parks. We've given guidance. We're communicating as best we can with people, and we need people's cooperation. And we're doing our best to keep people informed and to keep them at home.
Okay, thanks very much. That's all I got.
Okay, next we have Stephen Fisher with NBC 10.
Yeah, this question is for Dr. Farley. You mentioned that there is a first confirmed case.
I'm sorry, you're breaking up. I can't hear your question. Can you try again?
Here.
I think we're having some technical problems here. If you text the question in the chat feature, then we'll have it read in the room and answer it.
Okay, next we're going to Nina Feldman, I believe.
Hello, can you hear me?
Yes.
Great. Can you talk about any local efforts there in any detail that the department is making to acquire PPE? Like you said, there are, everybody's going to the same manufacturer. So are there any creative efforts underway to either manufacture them on a local level or, like you said, in addition to that, call out to other businesses that might have some of the gear? How are we thinking outside the box on this?
Well, first, we are requesting these supplies from the federal government to the extent that they're available, and we have apparently gotten some supplies recently. We have also been calling individually to individual companies that we're aware of that have some of these, but the reason for the call today is to recognition that we don't know of all the companies that might have those, and so any that might hear this message could make them available. As far as manufacturing, we're open to any manufacturer who could do this.
I mean, we are exploring opportunities for local manufacturing to try to get the specifications for the mask and see what manufacturing opportunities are available to produce them locally. We don't have an answer for you yet.
And I think finally, we're also looking at how do we extend the life of PPE so that it can be used again in the future.
Got it. Thanks. That's it for me.
Okay, we got the NBC question from the chat. The question is, can we disclose what nursing home Dr. Farley mentioned, who is going to the nursing home, and what is the plan once they get there?
The health department has staff that work with nursing homes on a regular basis and have real expertise in infection control in nursing homes. So the staff that do this routinely every year, we're going to be going to the nursing homes, that nursing home, and provide very detailed guidance on how to protect the additional residents. I don't want to identify the individual nursing home. I don't want people to take inappropriate reactions to that, but the residents and the family members of the residents in the nursing home will be notified so that they understand the situation and the steps that are being taken to protect the residents and the loved ones of the family members.
And a follow-up question is, how is the city preparing other facilities to prevent the spread among this vulnerable population?
So, there is a series of steps that we recommended that all nursing homes take to protect their population. We put it in writing. We have communicated with them on the phone. We've really driven this point home. All of them are aware of this risk. All of them have procedures in place that, each year during the influenza epidemic. And we are, also available for questions as they come up. That if they do these procedures right, they can greatly reduce the likelihood of an infection like this come in, but it's impossible for them entirely to prevent it because you could have, it is occasionally the case where someone can spread this infection just before they develop symptoms. And if that were to happen in a staff member, then you could have exposure in the nursing home. So we've done everything we can to try to limit that. We will continue to do that. The no visitor policy here is part of that.
Okay, thank you. Next, we will go to, I believe it's Denise Clay.
Yes, that's me. Hello. My questions concerned some, I guess, more municipal and or political stuff. One, has anyone heard anything about the possibility of moving back or canceling, or moving back or postponing the April 28th primary? Has anyone gotten to anyone about that in light of all this?
So as we covered, I think a day or two ago, both the surrounding counties and our city commissioners did request that the election be postponed, and those conversations are ongoing.
Okay, and the city budget when do budget hearings start, and will they be held virtually, or will people, or I guess, have you made plans about that?
So we are in current conversations with City Council and the City Council President on how to proceed with budget hearings. At this point, the initial budget hearings that were scheduled for next week have been canceled. And again, we are working with our council colleagues to determine the next best steps. Okay, and what is the status of the aid package that was requested by the mayor's office to deal with the coronavirus? The $85 million. So that is an appropriations bill that is scheduled for a public hearing in City Council next week, which will be done on Thursday, I believe, immediately before council session. That hearing will be done virtually, and we expect City Council only to meet for first reading of that legislation. Now, how are you all going to do this virtually, like this? Or how will the public be able to weigh in when they're not allowed to come in? Exactly. I think, Denise, you are experiencing that as we speak. Okay, well, this is a lot of people to get on Zoom, though. We will continue to work through this issue, but again, none of these situations are ideal, but we appreciate the public's patience and council's partnership as we try to limit social interaction and promote social distancing. Okay, thanks.
Okay, next up, we have Danya from Billy Penn.
Hi there, thanks so much. You might not have an answer because it's the weekend, but do you have any updates on how the PHL COVID-19 relief fund is going? Like, I'm curious about whether people have signed up to volunteer, whether new organizations have signed up for relief, and then perhaps on funding.
I think we'll have updates on Monday on that issue.
Cool. So then this is a follow-up to Sean's question for you, Brian, about the stringency of the message. You said specifically last week that you were trying to avoid using shelter in place, but other states have used that, and do you not think that stronger, like that kind of messaging would be stronger? Our reporters have also seen lots of people out in parties and picnics and such, and don't seem to be getting the message.
Sure. So I think both the governor, Governor Wolf, and certainly our administration already put these measures into place. And so when you look at the measures that Governor Cuomo announced, I believe yesterday or perhaps this morning, those measures are already measures that the city and the state took. And so if you want to call it shelter in place, call it shelter in place. In reality, people are still going to need to be able to get specific food, healthcare, essentials in order to make it through this crisis. We're going to continue to work with all of those in the business community and our various communities to continue to reiterate that people need to stay home. I think we've been pretty clear about that throughout these press conferences. We're continuing to think through creative ways. We're stepping up enforcement on businesses. We have received over 250 complaints to L&I about businesses that maybe should not be operating, and L&I is issuing warning letters. Hopefully those warning letters will be effective, and if not, we'll take additional action as appropriate. I don't think there's a single path forward on this. I don't think there's a playbook that was written. I think our efforts, the governor's efforts in partnership along with all of our colleagues across this country are trying to figure out how best to get this message. I think any city in this country is trying to figure out how do we convince people to stay home? How do we convince young people that they are as at risk of this illness as others, and that if should they contract it, they're putting their grandparents at risk. We have a sense of invincibility in this country and freedom. This is definitely a curtail on that freedom, and that's something that we're going to continue to push forward on.
Thank you. I mean, you've obviously given this a lot of thought. I just, the branding specifically, people who aren't tied into the news, all of us know to stay home, and you have been very clear about that, but, it's like the social messaging as far as shelter in place, and you mentioned other cities, and a lot of other cities have used that message.
Sure. Let me clarify my statement from yesterday. When we had a refinery explode in South Philadelphia, we told people to shelter in place. We did not want them to leave their house because we were in immediate fear of their safety. And so when I think of shelter in place, I think of that summer day when the refinery exploded. And so if I am hesitant to use shelter in place, that's how come. But certainly, we want our residents to stay inside. Yes, certainly.
I also think it's incumbent upon parents to make sure their kids stay in. I know it's difficult when kids are home from school and you're with them all the time, but those large group of kids playing basketball in a local playground, I think they all have parents, and those parents are responsible for directing their children to do the right thing. And I think it's incumbent upon them also to make sure that their children are in and safe, and we'll continue to push out that message. We can't physically restrain large groups of people. We're obviously not going to arrest anybody because we want our jails as empty as possible. And I do believe it's incumbent upon parents to act like parents and to make sure their kids stay home.
Okay, thank you, Mayor.
We have one question for Brian. Is there any update on the status of the schools, and will they continue to be closed after March 27th?
We don't have an update today, but we do expect to provide updates next week.
Okay, thank you. We have one more question from Sean Walsh at the Inquirer.
Thanks, I just forgot to ask this earlier. Dr. Farley, of the 12 people I think you said that are hospitalized, are any in the ICU, and if so, how many?
I don't have that information for you.
Okay, do we know if anybody is in critical condition or very severe?
I don't have that information for you, sorry.
Okay, thanks.
Our next question is back to Denise Clay.
Hi. I had this question for Dr. Farley. Could you please repeat for me the breakdown of cases in terms of age group? And also, have you considered in terms of the whole getting people to practice social distancing, maybe PSAs? Have you reached out to anyone in that regard?
So here's the age breakdown of the cases. 5 under the age of 20, 43 between the ages of 20 and 39, 20 between the ages of 40 and 59, and 17 in age 60 and up. You know, as far as public service announcements, those public service announcements that you typically see tend to run at 3 o'clock in the morning when nobody's watching. I would say that there's an awful lot of coverage of this, and we're going to use as much of that as we can when we're talking to the media to drive home the message that people need to stay away from others and stay home.
Okay, final call for questions. Okay, that's it. Thank you.